Other than a newly diagnosed patient's stage of DLBCL and their age, what other factors would impact a treatment decision?
Yeah, so that's a good question. So you named, I think, the biggest two, the most important two. Although I have to say that, even people in their, oftentimes in their 80s, are prescribed full dose therapy. The goal of our treatment, especially in newly diagnosed patients, is to cure the lymphoma. And so we tend to be aggressive. But outside of age, other things we consider are, other health problems. Does the person have a healthy heart, healthy kidneys? How many other medical problems does the person have? How fit is the person? How sick is the person, or symptomatic is the person from his or her lymphoma? And sometimes we take into consideration all those factors and we say, well, it's still worth it to try to deliver the most intensive therapy that we can. Other times we say, I think the risk of doing such is probably not worth the potential benefit. And so sometimes we'll recommend dose reductions, reduce the doses of some of the medicines in the R-CHOP cocktail if that's what we're going to do. And occasionally, if the person has too many other things going on, we may talk about more palliative treatments. In other words, gentler treatments that may extend a person's survival while hopefully maintaining a really good quality of life.
Yeah. What kind of side effects should patients expect?
Well, that's a conversation I've had many, many, many times over the years.
Sure.
And specifically to the R-CHOP cocktail, just because that's the one that's used most commonly. I tell people that the most common things are symptoms like fatigue, occasionally nausea, sometimes vomiting, although the medications we have to prevent those things are very good these days. Constipation is not uncommon, hair loss, mouth sores. I think probably the most important thing is to recognize that the chemotherapy will suppress or reduce the immune system. And so we're always worried about people catching infections when they're on chemotherapy, because sometimes they can be serious. And then I talk about rare symptoms that are a big deal. Sometimes the chemotherapy can damage organs like the heart. It's uncommon, but it happens sometimes. And chemotherapy, while we need to give it to cure the lymphoma, can sometimes cause secondary blood cancers like leukemias years down the road. The risk is low, but again, these are, I think, serious things that people, even if they're rare, people need to know about them before they start.